Good afternoon, everybody, and happy holidays. I want to thank everybody for coming to this Dean's Lecture. And I know we have a great turnout, and it is finals week. And so even with that, some people, Ken's laughing because he doesn't have to take finals anymore, but thank you. So I think everybody knows that we hold these Dean's Lectures to celebrate the appointment or promotion of one of our faculty members to the rank of professor. And it's not easy getting on the faculty at Johns Hopkins, but it's an incredibly high bar to be promoted to professor. And so that's why we take this time to stop and reflect. And it's especially nice to be celebrating the promotion of Jon Vernick, one of the first faculty members I met when I came to the school, and someone who's been a leader here. He's a double alum from Johns Hopkins. He got his undergraduate degree in sociology from the Krieger School in it wasn't the Krieger School then, but in 1986, and then went to George Washington University in D.C., where he received his J.D. degree. He was a senior associate after that at the Institute for Injury Reduction in Washington, D.C., and then came here to the Bloomberg School in 1991 as a research associate in the Department of Health Policy and Management. And then it seems like there's this well-worn track in HPM. Sue Baker started, came to work and then got infected with the public health bug and then got an MPH degree, which Jon did as well in 1994. He holds a number of leadership positions in the school. He's just about to assume chairmanship of our ethics committee that deals with issues related to academic ethics with students. He's the associate chair of finance administration, health policy and management. He's co-director of the Johns Hopkins Center for Gun Policy Research and co-director of the Center for Law and the Public's Health. In addition, he's co-director of the MPH JD Joint Degree Program and is a member of the MPH Executive Board. So Jon was appointed in 2014, and so we're having this a year late in part because of some scheduling difficulties. But as we were talking right before, it couldn't be a more topical topic, both with the anniversary of Newtown and then also with what's happening in presidential politics. Jon does research. He's a triple threat. He does research, he does teaching, and he does service. And his excellence in teaching has been recognized a number of times here at the school. He teaches courses on issues in injury and violence prevention, public health and the law. He's won the Teaching and Advising Award, and he was named the Outstanding HPM Faculty Member of the Year in 2011. As I said, he's a two-time recipient of the AMTRA Award from the Student Assembly. So Jon brings a broad perspective of public health and the law to a number of issues, with injury, gun, policy, and he's concentrated on that intersection, on how regulation and litigation can improve public health, specifically in reducing the incidence and severity of injuries, especially those caused by motor vehicles, firearms, and consumer projects. He's written over 100 scholarly articles and has been a consultant and invited speaker on many occasions. He, like many people in health policy and management, I always say to Ellen that HPM is really the tip of the spear, that takes evidence and makes change. And Jon is a great example of that. You've worked really hard to take those tools that you have to create effective public health policy. He works with legislatures, media, courts, and advocates to provide information and technical assistance. He helps lead the Eastern region of the Network for Public Health Law that's funded by the Robert Wood Johnson Foundation. He's a member of Delta Omega Alpha Chapter and received the American Public Health Association ICEH S Section Public Service Award in 2013. Please join me in congratulating and welcoming Jon Vernick.
Thanks very much, Mike. And before I begin the talk itself, I just want to thank the department, the school, the university for its enormous support of this work. And actually, it's more than just support. Ellen McKenzie is chair of HPM, and Mike Clegg as dean of our school and Ron Daniels as president of the university have actually been active partners in the work, more than just supporting it, as those of you who remember our symposium that we held in 2013. So it's just a wonderful place to do this kind of work, very different probably from many other places one might choose. So I'm going to talk today about why changing gun policy in the U.S. is so difficult, and as Dean Clegg has said, it couldn't be more timely with the 3-year anniversary of the Newtown shooting just yesterday. But with a admittedly somewhat downer kind of topic, like why is changing gun policy so difficult, maybe it's good to start with some good news, right, to begin on a more positive note. And there actually is maybe a surprising amount of good news on this topic. Even since the Newtown shooting, you'll see that in 2013 alone, 15 U.S. states representing about 44% of the population strengthened their gun laws. If you include 2014 and 15, the number is now more than 20 states with major new laws. The number is even higher if you count more minor laws, and you can see some of the states, just some that acted there. And as I say, these are not insubstantial laws that states enacted, including licensing buyers, expanding background checks, banning weapons and people. So there has been success. But yes, there is bad news as well, why more states or the federal government have not acted. And because this talk is going to involve a fair bit of bad news after bad news here, maybe you all want to briefly call up your happy place, right? In case you need to go there. So this, if you don't have it handy, this one is mine. You feel free to borrow it. I've actually sat on that beach in the Netherlands Antilles on more than one occasion. So come back there if you need to. All right. So I'm going to start with the conventional explanation for why change hasn't happened. But I'm actually going to move away from the conventional explanation pretty quickly because the conventional explanation is easy. That doesn't mean it's wrong. By labeling this explanation conventional, I don't mean to imply that it's not an important explanation. But I think that there are many other explanations, maybe some that are more relevant to a public health audience that I especially want to cover. So the conventional explanation, the power of the National Rifle Association. If you go to their website, they claim nearly 5 million members. It's not crystal clear because there's no one counting, there's no auditing, right, whether that's really true. And the number has sort of bounced up and down over time. For many years, though, the NRA was more like what you might imagine a group like that would be, which was more of an enthusiasts organization. But beginning around 1975, they established the Institute for Legislative Action, the NRA-ILA, and became much more active in politics, and in particular in opposing virtually any kind of gun policy. They actually supported the 1968 Gun Control Act, which, as it sounds, is the sort of bedrock federal gun law, but things really took a shift in 1975. And so the conventional explanation goes that NRA members are deeply supportive of the position that they support, if you prefer, deeply opposed to most gun laws, and whereas there is broad public support by comparison, that deep support trumps the broad public support. And one way that it's helped to trump that broad public support is the state of campaign finance law in our country, or if you prefer, the lack of campaign finance laws in our country strengthen one issue groups like this. I took this final quote, again, from the NRA website. They call their congressman, they write, they vote, they contribute, and they get what they want over time. Anyone know where this quote comes from? Again, on the NRA website, it's George Stephanopoulos, who was President Clinton's communications director. So again, this has become sort of conventional wisdom. And again, that doesn't mean it's wrong, but I think it's not nearly all of or enough of the explanation. Just to prove to you that there, in fact, is broad support in national gun policy polls, this is reporting the results of two polls that we actually did, polls led by Colleen Barry and Beth McGinty here at our school. You can see one in 2013, shortly after the Newtown shooting, and one in 2015. I was told to use the cursor to highlight things I want to highlight. So you see, we also have divided things by non-gun owners and gun owners. The first policy that is on this slide says, should we require a background check for all gun sales to make sure purchasers not legally prohibited? And you see very high levels of public support among gun owners and non-gun owners alike. Anecdotally, I think some of this may be because a lot of people think that was the law already, right? A lot of people think, of course, there's a background check required for every gun sale already. That's actually not the case under federal law, and it's the case in only 18 of the 50 states. You can see also high levels of public support, again, among both gun owners and non-gun owners for prohibiting people who've been convicted of domestic violence crimes, or even for requiring a license. Again, this is not something we currently do, although many people think we do, require a license from law enforcement before buying a gun. There, gun owners are somewhat less supportive, but still almost 60% of gun owners. So again, the explanation is you have this very broad public support that gets trumped by the very deep, strong NRA opposition, again, if you prefer. Okay, so now I'm going to move into the other kinds of explanations, and we'll come back to some of the NRA's role in some of this as I go. But the first reason, which I think will have substantial public health resonance, is who's actually dying of gun violence. So here's the U.S. firearm homicide rate. For all ages and all genders in 2013, it's about 3.5 per 100,000. And PowerPoint will do a neat thing for you if you want to graph more than one thing on the same slide. It will tinker with the y-axis for you, which is very helpful. So good on you, PowerPoint, right? So here's white males, or if you prefer, I could have labeled this bar the majority of members of Congress, right? So their rate of dying from gun homicide is a little bit less than the rate for all ages and genders, but same order of magnitude. If you then add in young white males 15 to 24, again, notice what's happening to the scale on the left axis. Notice how the blue and red bars start to look less meaningful, start to shrink a little bit when you start adding in white males, and you all can probably figure out where I'm going with this already, right? When you add in black males, again, the scale changes, and the blue and red bars start to look tinier. That purple bar, now we're talking about 27 or so per 100,000. And then finally, if you add in black males ages 15, yeah, you're supposed to gasp when I do this. When you add in black males 15 to 24, my gosh, the bars for white males, members of Congress, start to look insignificant by comparison. And I have to ask a rhetorical question. Who among us really believes that if black males, if white males, or even young white males were dying at the same rate from firearm homicide as young black males, that we wouldn't have done something by now? If this problem were not so concentrated in a politically less powerful, economically disadvantaged group, who really believes that we would be stuck where we are today? Okay, next reason. What's the leading cause of gun death in the United States? I've just shown you something about homicide, but actually it's suicide. Maybe that surprises some of you all. This is the pie chart of the 33,000 gun deaths that occurred in the United States in 2013. That's the most recent year for which we have final death certificate data from CDC. And you can see in blue, almost 2/3, 63 some odd percent of the gun deaths are suicide. It's a remarkable figure. It's actually the case that there are more firearm-related suicides. There are more suicides committed with a firearm than there are suicides committed with every other method combined, which is another way of saying more than half of the suicides are gun suicides, but it sounds more powerful that way, right? So 21,000 of the 33,000 deaths are suicide. And unlike what I'll show you for homicides in just a moment, the actual number has been climbing lately. That 21,000 is the highest number we've ever had, at least going back to the 60s on this chart, and likely going even further. So why hasn't suicide driven change? And I think the answers are people have, I think, a different view about suicide than they do about firearm-related homicide, a different view about, frankly, whether suicides even are preventable at all, whether a person who doesn't have access to a firearm for suicide will simply substitute an equally lethal method and wind up just as dead. The good news is that actually relatively few people who survive a suicide attempt and get some treatment make a second suicide attempt. I have a colleague, Matthew Miller, who used to be at Harvard and now at Northeastern, who says that being treated for a first suicide attempt, it sounds a little callous, but he means it in a positive way, is actually a pretty good diagnosis to have relative to cancer diagnoses or other kinds of diagnoses. Your likelihood of survival is extraordinarily high if you survive that first suicide attempt. And that's, of course, the key, surviving that first suicide attempt. And so what that means is that the case fatality rate makes a big difference. The share of suicide attempts, you all know this from Epi, right? The share of suicide attempts that ultimately result in death. That is to say, it's another way of saying the means matter, the means that you choose in particular for that first attempt. Now, it turns out the case fatality rate for suicide attempts with firearms is very high, greater than about 90%. Guns are very good at doing what they're designed to do, right? What's the case fatality rate for other popular methods, pills or cutting? It's actually under 3%. Remarkable. So if you choose a firearm for your first suicide attempt, you're very likely to die. And if you choose another method, you're very likely to survive, hopefully get some treatment, and then not go on to another attempt or ultimately to die. But unfortunately, suicide doesn't drive the policy debate in this country. Again, because I think people have a mistaken belief that people bent on suicide will simply find another method, when if all we did was push people's first suicide attempt from one method to another, even if we didn't prevent that first suicide attempt, if all we did was move it from one method to another, we would save an awful lot of lives that way. Okay. Next reason, changes in firearm homicide rate trends over time. I said I would show you something about firearm homicide rates. Here is the raw number of firearm homicides in the United States from 1962 to 2013. And again, I'll see if I can use the cursor here. You can see that today there's a little over 11,000 firearm homicides. But if you cast, and that number has been pretty stable, there's been some up and down, over the last decade or so. But if you cast your eye back to the late 1980s and then peaking in 1993, you see a very, very different pattern. You see a dramatic increase in the late 80s and then peaking at more than 18,000 in 1993. In 1993, actually, total firearm deaths exceeded 40,000, which is an awful lot of people not walking around who would be walking around if our numbers were more like they are today. So some of you don't recall what the policy climate was like 20 years ago, but as Dean Clegg says, I've been doing this for a long time. So I was around when this was happening, as were many others in our gun center. And when that figure was increasing so dramatically, as you see here, policymakers actually were forced to respond. People were afraid to walk on the street at night. New York City, which today has fewer than 500 homicides a year, had more than 2,000. The cities, in particular, looked very different, and policymakers felt obliged to do something. There was the kind of pressure that, for some reason, 11,000 homicides doesn't cause. There really ought to be the same pressure, right? 18,000 versus 11,000. Here's a graph that I did some years back, and you can see exactly what did happen. This is the annual number of new major state gun laws. And there's some noise in the data here, but you can see happening exactly what you would predict would happen if the numbers were rapidly increasing in the late 80s and then spiking in around 93. You see a tremendous number of new laws with precisely the kind of 1 or 2 year lag that you would expect, right? The numbers get people upset, appear in the media, and policymakers respond. But then, having responded, everything tails down again. So, unfortunately, it seems that 11,000 homicides a year don't have the same impact on policymakers that 18,000 or 40,000 total gun deaths did in the early 90s. And we have to figure out how to change that, because we clearly don't want to have to wait until this many people are dying again before we can make appropriate policy change. By the way, this is an example of what my colleague Scott Burris at Temple University would call legal epidemiology. Everything has to, you just put something in front of the word epidemiology and you can call it a new discipline, right? So legal epidemiology. Another reason, Steve Terrett has taught us, some of you know Steve as the founding director of our gun center. He's taught us about the importance of this concept of preemption. And within gun policy, preemption is particularly important, I think, but maybe in ways that haven't been as clearly identified. The idea behind preemption says that if a state has preemption of gun laws, what that means is that gun laws within that state must originate within the state legislature. They can't occur at the local level. So the state preempts or prevents localities from enacting their own kinds of gun laws. So that prevents localities from addressing quintessentially local problems. It often pits rural versus more urban areas within a state. Gun ownership rates, especially long guns, are much higher typically within rural areas within any given state. And so you often see this dynamic in state legislatures. Maryland is no exception. The city of Baltimore wants stronger gun laws. Garrett County, I'm assuming that's a rural county. Garrett County doesn't, since I don't know. Garrett County doesn't want, and you have deadlock, and the state doesn't act. But in addition to preemption causing this kind of gridlock, it also, I think, and very importantly, stifles innovation and inhibits diffusion of that innovation. Localities are really supposed to be engines of experimentation within our country. The stakes are lower when Tacoma Park decides to enact some gun law, and we can see if it works. And if it does, then that innovation can diffuse either sideways to other localities within the state or up to the state level. And we have a number of examples in states that don't have preemption where that precise phenomenon has occurred. My former student Greg Tung demonstrated just how important preemption, or the lack of preemption, is for permitting this kind of diffusion of innovation. Unfortunately, today, more than 40 states preempt most or all localities from enacting gun laws. And why is that? Well, here's the promise, circling back to the National Rifle Association. The NRA made enacting state preemption of local laws its number one legislative priority in the late 1980s. They were smart from their perspective. They realized that it was easier to put out fires from their perspective in 50 states than in thousands of or tens of thousands of localities, and it worked. But again, I think it did more than prevent laws in those localities. I think it prevented those experiments from being carried out and winding up, diffusing upward. Absence of federal regulatory authority, another reason here. It turns out that the Consumer Product Safety Commission, the CPSC, that's the federal agency that has the authority to regulate the safety of most consumer products in the home. Think of your appliances and other things. Shortly after it was created in the 1970s, Congress denied CPSC the ability to regulate guns or ammunition. So CPSC is in this funny position where it can regulate toy guns, but not real guns. It can regulate gun locking devices, these aftermarket devices you can put on guns, but again, not the guns themselves. You might then ask, well, what about the Bureau of Alcohol, Tobacco, and Firearms, ATF? They actually also have traditionally exercised very little rulemaking authority in this area. What little they have tends to focus on gun dealers. So we're actually, again, in the bizarre situation that if a gun is actually defective, if the gun is prone to firing when it's dropped or bumped, for example, there's no agency that can even recall a defective gun. It's unbelievable. So the effect there is that almost everything at the national level has to come from Congress. And we know how difficult that is. The regulatory state in this country has become an enormous source of public health law in this country. And if you don't believe me and you're a student, you should take Lainey Rutko's fourth-term course on the power of the regulatory state. Frankly, even if you're not a student, you should take that course. So, for example, the National Highway Traffic Safety Administration, NHTSA, is the federal agency that promulgates regulations with regard to cars, and there's dozens and dozens of regulations. If all of those regulations had to come from Congress, where would we be? So again, another reason that I call to your attention. Suppressing research. This has been in the news lately as there have been efforts to quote, undo what I'll describe to you in a moment. But I would suggest to you that research makes an enormous difference in this area. It's rare that research is sufficient by itself to promote policy change, but it's clearly necessary. And unfortunately, there's much less intervention or policy research in this area, particularly the sort of what works and what doesn't work than is needed. To be honest, and I realize this seems maybe a little unhumble, but what we have, a fair bit of it comes from right here in this school, from Daniel Webster, who's the director of our Center for Gun Policy and Research. If he wasn't out there doing the kind of policy evaluation work that's critical here, the what works and what doesn't, we would have substantially less than we even have. So why is there much less research than is needed ultimately? So here's a little timeline for you of the explanation. If you cast your eye back to 1985, the left side, the National Academy of Sciences publishes, with the help of Sue Baker here from this school, the book Injury in America, and that book encourages CDC to create the National Center, and CIPC, the National Center for Injury Prevention and Control, and begin a determined program of injury research, and they do. They do begin that program, and they begin studying not just guns as a risk factor for death and injury, but what can be done about it. And in 1995, they spent a total of $2.6 million on firearm injury research. That doesn't sound like a lot, but it was something. And of course, what CDC does, other places follow. They have a leadership role to play. But in 1996, at the urging of pro-gun organizations, actually Congress attempted to eliminate NCIPC. They were arguing that the research that CDC was doing was harmful, and in fact, it was harmful. It was harmful to their interests because it began to show that policies matter. It began to show the risks associated with guns. Now, they didn't succeed in ultimately eliminating NCIPC, but they did remove $2.6 million from CDC's budget, precisely the amount it had spent in 1995, and they added language to CDC's appropriation legislation, which remains to this day, that says that CDC is prohibited to advocate or promote gun control. Now, of course, they weren't really advocating or promoting gun control at any point, but you can understand the message that this would send to CDC. The message it sent was, if you do gun research, you're risking your very existence. It was an existential threat to CDC, an existential threat that remains today. An interesting study was published in JAMA just a couple of years ago, looking at the result of that, and it was a very real result. About a quarter fewer papers published on guns in PubMed than would have been predicted based on pre-97 trends and trends in the publication of other things. So this has mattered. The opponents of research got their way ultimately. So then we've mentioned the Newtown anniversary in December of 2012, and then shortly after that, President Obama actually directed CDC to start studying the causes and prevention of gun violence. Again, that didn't lift the restriction on CDC, but the restriction doesn't prevent CDC from doing these kinds of things. But as you see in the final box, in the time since 2013, CDC still has not released an RFA specifically devoted to firearms. And, I understand. I do. As I say, it's an existential threat. So I'm not laying this at the feet of CDC. It's a tough call. They have an awful lot of other kinds of injuries they're trying to prevent, much less the rest of CDC's agenda. I lay this at the feet of others. In fact, Representative Dickey, who was one of the staunchest proponents of eliminating this money from CDC, recently came out saying he thinks he's made a mistake. But even that hasn't caused a change. How about the way the media covers this particular issue, the issue of gun violence? Unfortunately, as I think you all know, the media tends to focus on mass shootings and tends to focus, maybe therefore, on mental illness. So mass shootings, although they get an enormous amount of attention, are really a tiny portion of our gun violence problem in this country. If you if you divide 33,000 gun deaths by 365 days a year, there's in the ballpark of 90 gun deaths a day. So we're having a mass shooting every day. We're having a Newtown, a San Bernardino, a Virginia Tech, a Columbine every single day. It's just happening one at a time and under the radar. But of course, that doesn't appeal to the media, and so that's why I think there's a focus on mass shootings, which are frankly harder to prevent, because often you have very, very determined people. The focus on mental illness, Beth McGinty, a professor here, has helped to teach us, is also interferes with our ability to make change. It turns out she and Professor Jeff Swanson at Duke have helped to teach all of us that actually most people with mental illness will never be violent, and most violence is not committed by people with mental health problems. So that doesn't mean we shouldn't try to expand coverage for mental health and do other things that we can do, but I think it takes our eye off the ball. The media also likes to manufacture conflict. That's what sells paper. Do people still buy? I still get a paper. No one buys papers. That's what brings eyeballs to websites. Conflict, right? They want to make it. They want to make it the gun banning people against whoever else. When actually most of the country is somewhere in the middle. It's a false conflict, a false dichotomy, and it results in this sort of he said, she said style of media reporting, which gives people the impression that nothing can be done, that this is just two folks on either side of the spectrum who will never ultimately agree. And then my pet peeve, the willingness to allow non-experts to comment on the side. Would we allow non-experts to comment? Would the media allow non-experts to comment on the science if it was a paper about mitochondrial DNA? I sort of doubt it. Susceptible states act, and then it can be harder to get other states to follow. Here's a couple of examples for you. So sometimes we do see diffusion of innovation. We do see quick change. Child access prevention laws are laws that say if you're going to bring a gun into your home, you have to store it safely. That seems pretty reasonable, right? Actually, the very first such law in the country was enacted by, of all states, Florida in the late 1980s, 1989. And then this is more legal epidemiology. On the y-axis is the cumulative number of states with such laws, and the x-axis is time. So you see here's Florida, and if I can find the cursor there, here's Florida enacting the first in the nation such law in 1989. A bunch of susceptible states pass CAP laws, child access prevention laws, and today there's a total of 18 states with child access prevention laws, which is remarkable. But now look at the flat line up here. No new CAP law, if you don't count the District of Columbia. No new CAP law for more than a decade. Why is that? It's not because of research. It's actually one of the few areas where there is substantial research that these laws save lives, reduce accidental deaths, reduce teen suicides, and yet no change. The susceptibles acted, and others didn't follow. Here's another example, an example of susceptible states, but not the others, and it's about licensing of gun dealers at the state level. And so let me start by asking you, you didn't think you'd be asked this particular question. How many states license professional haircutters? And it's important, right? I mean, they can do major damage to you. I mean, if you get an unlicensed haircutter. So how many states license haircutters in the United States? Well, all of them, right? Thank God. So and that's why your cosmetologist displays that little license. So how many states license gun dealers as a matter of state law? Just again 18. And look at all that white space in the middle. So susceptibles again, and I don't have the similar kind of slide for cap laws, but there's been no new state law requiring a state license for gun dealers in a very long time. How about the number of guns in circulation? This is a reason that people raise with me all of the time. They say, my gosh, there's so many guns in circulation. Whatever we do can't possibly make a difference. There's a sense of futility or fatalism about guns. By the way, how many guns in civilian? How many million guns in civilian? The number of question marks there should be a clue, right? So there's 300 million guns in civilian hands in the United States. That's one for approximately every man, woman, and child. But actually, and despite the difficulty of conducting this kind of research, there's a lot of evidence that laws can keep guns from dangerous people, can make it harder. Criminals, for example, again, research conducted here that Daniel Webster and a postdoc were involved in some years ago show that actually criminals prefer newer guns, for example. And not all of those 300 million guns are created equal. Not all are the same. Here's the pie chart of firearm homicides by type of gun. So this is just gun-related homicides. Despite the fact that of those 300 million guns in circulation, about 60% are rifles and shotguns, long guns, hunting guns. It turns out that among the homicides for which we know the type of gun, about 90% are committed with a handgun. This number has been stable for many, many, many years, within 1% or so. So although there are only 40% of the guns out there, they're 90% of the firearm homicide problem in the United States. Well, I think I want to, after all of this bad news, I want to leave you with a little parable I sometimes tell my students here. The real key, ultimately, is to keep guns from flowing from the lawful to the unlawful market in the United States. Most every gun that winds up in the hands of criminals is first sold legally in the U.S., and our goal is ultimately to keep those guns from flowing, like water flowing out of your sink onto the floor. So the parable I tell, and this relates back to the 300 million guns in circulation, is imagine, you don't have to close your eyes, but you can if you want. Imagine that you're doing the dishes. For some reason you don't have a dishwasher, and you're doing the dishes in your sink, and you get called away for a moment, and the water is continuing to flow in your sink. You get called away, and you forget to turn off the tap. You're, I don't know, answering the phone or dealing with your child, and by the time you finish, you come back, and wow, your kitchen, maybe your whole house, is just flooded with water, flooded with guns that have flowed from the lawful to the unlawful market. Wow, your house is a disaster. It's going to take a very long time for your house to dry out. What's the first thing that you're going to do when you get back to the sink? You're going to turn off the tap, right? Does that mean your house is going to dry out right away? No, it's going to take a while. But that doesn't mean you shouldn't begin to do the kinds of things we know can work, again, to keep those guns from flowing from the lawful to the unlawful market. So I hope that left you with a slightly more hopeful way of concluding, and I am very happy to take your questions. And I am told that if you do have questions, it's best to go to the microphone.
Yeah, so this is being podcast and webcast, so people won't hear the questions unless you're at the microphone. The other thing I want to remind people is that we have a reception afterwards, so we don't get through all the questions now. We have time to ask you individually.
Terrific.
So, great talk, talk.
Thank you.
So lots of questions. Has a municipality ever sued a state for the right to regulate guns?
Terrific question. It turns out that would be a very, very difficult lawsuit. In the United States, the municipalities are essentially creatures of the state, creations of the state, and they have only the power that the state gives them. So the state can give them lots of unfettered power to regulate guns, or the state can take all. It's like my father used to say to me, "I brought you into this world, and now I'm in charge of you." So states bring municipalities into this world. Now, some years ago, a bunch of municipalities began to sue the gun industry. Actually, they said the way that you're marketing your guns, the way you're designing them, is contributing to this problem. And those lawsuits were beginning to percolate through the courts. Some of them were dismissed. Some of them were looking more promising. But then in 1995, 98, I can't remember. No, it was 2005. Thank you. President Bush signed a law called the Protection of Lawful Commerce in Arms Act, which basically gives the gun industry unprecedented protection from liability. So even that kind of lawsuit is now incredibly difficult to bring.
So I can understand thinking that it's a right to bear arms. Second Amendment protects that, but I don't get the objection to the childhood access issue, because certainly minors don't have a right to injure themselves, and it doesn't prevent the gun owner from having access to the gun. What's the rationale for? It's
very tough. There's probably a number of different possible rationales to object to a child access prevention law. One is, well, I won't have my gun ready at hand to defend myself against the criminal who invades my home if I have to store it safely. But it turns out there's lots of devices on the market that will give you almost instant access to the gun that's been locked up. So I think the real argument is they're afraid to permit any kind of law because they perceive it as the first step down the slippery slope to the midnight knock on your door where we'll take away all guns, when actually no one is talking about that.
Okay. So yeah, please, Peggy, would you? I can just bring this over.
I guess if people, oh, you're going to bring it over. Great, thank you. Hi, Peggy.
Thanks, Jon. Great talk.
Oh, thank you. I love that question. Thank you.
So one thing you didn't mention, I mean, you did just in your answer right now, is the impact of the gun manufacturers. And, you know, I haven't heard much about that. So do they operate mainly through the NRA or?
Well, I guess it depends on who you ask. So the gun manufacturers do lobby on their own. They have their own lobbying organizations. They also work closely with the National Rifle Association as well. It's not precisely analogous to the tobacco industry, though, where it was really the industry that was fighting regulation. Here, it's more the user group, the NRA, but both are clearly involved. And some of us think that one of the main industry organizations is called the National Shooting Sports Foundation, NSSF, and they have become more active recently too. Thank you.
So I'd ask people to come up to the mics if you have questions.
That's going to inhibit questioning, I suspect.
Go ahead, Paul.
Thank you very much for that really interesting talk. I had a question for you about messaging, since that was just brought up. And while we all may not agree with the NRA and their progeny, they are excellent at getting the word out and getting messaging out. So I'm wondering if you have any advice, thoughts, analysis of how we do on the public health side about our messaging, and if we could do it better.
Yeah, and we have some experts in the room here about messaging as well. Josh Horowitz is here, who runs the Coalition to Stop Gun Violence, and we're very fortunate, also teaches in our school a course on advocacy in the fourth term, and he, I think, would say, or maybe I'll paraphrase him, that the NRA has been able to get away with occupying the sort of mantle of freedom here, that this is about our right to be free from government interference, our freedom to have a gun. But what about the rest of us and our right to be free from gun violence, free to walk the streets of our neighborhood, send our child to play at a neighbor's home? And I think we're just beginning to do a better job of messaging on that side. So I think you're right. The NRA has been brilliant at messaging, and we're starting to get better, I hope, on our end.
It really was a provocative and very important session that we're having, John.
Thank you.
I think we should all be very grateful. Another piece of the question is who, in fact, are the kids who grow up to be people who use the guns for killing and for establishing their place in the world, what little there may be. The epidemiology, developmental epidemiology, has very important things to say on that topic. Early aggressive disruptive behavior, as early as first grade or earlier, is one of the hallmark risk factors for violence, incorporation, heavy drug use, high-risk sex, and the profile of outcomes we don't like. And early aggressive disruptive behavior is amenable. There are, in fact, and not just the good behavior game before, like Delphi, anything about it, but there are other interventions, preventive interventions, which could, in fact, alter these early risk behaviors. What we tested here in the trials was whether that early risk behavior was malleable. The answer was yes. And the question then was, if it was malleable, did it alter this whole profile of acting out behaviors, which, by the way, is 2.5 times more frequent among males than females even 20 years ago when we were doing it. So if we combine these strategies of looking at the population and the structure of laws and beliefs and political exercises, and we combine that with a developmental perspective, my last thought on this is teachers are not trained in how to manage classrooms at all in the United States, not required for teacher training. And about half the classrooms in the trials in Baltimore showed that teachers needed desperately to get the tools to manage classrooms. When you manage the classrooms, which is what the good behavior game is all about, as well as some of the other interventions with parenting, you find that that makes a huge difference. The National Accreditation for Teacher Training does not include classroom management nationally. So when we put our thinking together, we've got a strategy for, in fact, a more holistic, and we can then look at the relationship of universal preventive trials to back up services as needed for treating the right.
Yeah, I appreciate those thoughts. So I'm a policy person and law person, but clearly that's only part of the solution, and I'm grateful that there are others who work on the other behavioral side of the equation. Yes.
And that was a great talk. What do you think the public health community, both public and academic, can be doing better on the political side of the issue? When I say political, what I mean, there's a lot to be said about Congress, but we're at a school of public health, we have a public health community. Do you think the public health community is approaching the politics of this issue the right way?
Yeah, terrific question. So let me take a step back from your question and give you just a handful of what I think of as some principles here that not just the public health community can apply, but that we can all apply. The first is we have to resist this notion of fatalism, that there's nothing that we can do. I was just reminded by a colleague at CDC, actually, that Bill Foege, who used to be the director of CDC many years ago, said that optimism was one of our most important tools within public health, believing that we can actually make change here. Public health is about the long view, obviously. If you are expecting to make change tomorrow, you're likely to be disappointed. But if you're going to take the long view, then you might as well have big ideas, right? You might as well go for big change. So there's a place where I think public health doesn't always in this area. I'm not speaking now about our school, but maybe some others. It doesn't always succeed. That is is more willing to go for small victories when what we clearly need are some bigger ones, at least in addition. I think public health, for a long time, there was sort of an unhealthy dichotomy between public health approaches to gun violence prevention and criminal justice approaches, and I think both are critically important. Both clearly have to work together on this particular issue. So public health needs to be doing a better job of working with others, and all of you contributing what you're good at. I have a friend and neighbor who's a professor at Goucher and doesn't work on this precise issue, but she's good at using social media and encouraging her friends and colleagues to care about this issue as well. If all of you were as active on social media, then maybe some of that broad support that I showed you in the polling slide would translate into the kind of intense support we need. The kind of intense support that does a better job of holding policymakers accountable. What happens now is policymakers correctly perceive risk in voting against the gun lobby, but little risk in voting against the majority of their constituents. And public health has to figure out a better way, and not just public health, of holding policymakers accountable. If I had, unfortunately, I realize these are generalizations, they're labeled principles, but if I had the more specific recipe, then maybe some of the slides I showed you would look a little bit better. But thank you for your question. Well, I see that it is 5 o'clock. Oh, is there one more question? I'm sorry, Darryl. Yes, please.
We'll have Darryl have the honor of the last question.
Very
and then we
good.
can break.
Enjoy your talk. Congratulations. I have two questions I wanted to pose to you.
So you'll enjoy the honor of the last two questions.
Right. Well, one has to do with in your list of reasons, you didn't really say anything about sort of gun culture, preference for guns, because one of the things that always strikes me is after one of these mass shootings or something, then people go out and buy more guns, and so there seems to me that while there's a preference for gun control, there also must be in some way some preference for gun ownership and gun culture
Yeah, well, let me be clear that I clearly didn't cover every possible, I should have said this up front, every possible reason. That would have been a very, very sadly long, go back to your happy place, long talk. But you're quite right. Unfortunately, after mass shootings, we see spikes in gun sales. Fear drives gun sales, and one of the reasons that fear drives gun sales is that people mistakenly believe that bringing a gun into their home will make themselves and the occupants of that home safer, when study after study shows the opposite is the case, particularly with regard to things like suicide. And maybe here's another role for public health, which is making it clearer that the data doesn't support that. It might make you feel better, but it doesn't actually ultimately confer protection.
So then I guess then your sense of the preference for guns is driven by fear of violence, being able to protect oneself, as opposed to just the thrill of sort of being the person who can shoot firearms at
Well, I wouldn't want to generalize, but yes, I think especially after mass shootings, that's the reason. There's another thing that drives gun sales is when new laws are enacted or proposed, the gun lobby does a superb job of arguing that that's the end of gun ownership, and that if you don't buy your gun now, you'll never get one, and so that clearly, again, inaccurately drives gun sales.
And the last thing is technology. The way in which we manufacture guns and what they're able to do changes over time. And so how do you think policy should keep up with the way in which technology in terms of the lethalness, the ability to fire so forth. How do you sort of envision policy keeping up with
So
technology?
gun design has actually changed very little over time. If anything, it's made guns more lethal, more able to fire multiple rounds. There are policy solutions to that, things like mandating the size of the ammunition magazine, things like saying that military-style firearms that make it easier to engage in mass kinds of shootings shouldn't be permitted. And then Steve Terrett here working on ways to change the design of the gun itself to make it safer. So there are policy solutions. The absence of federal regulatory authority means that where the action is on those proposals these days, and most proposals, remains at the state level.
Well, thank you, Dan.
Thank
So-
you all very much.